Dr. Dhananjay Gupta, Director, Orthopaedics, Joint Diseases at Fortis Hospital, Vasant, Kunj. It's a great pleasure to connect with you all. Today is 20th October, and today is the World Osteoporosis Day. But 12th October was the World Arthritis Day. And this whole week, rather month, is celebrated as Bone and Joint Week and Month as well. If you look at the world data, the term so-called musculoskeletal disability means that any person who is not able to do their optimum physical function or activity because of the muscles and joints and the bones problems, they form a great subset of the population who are living with years of disability. In the younger, right from the day you are born to the day you have your last breath, you are supposed to have an active life. The life means full of activities, motions, movements, whatever you are born to achieve, that is your destiny, that is achieved through the physical form, and your musculoskeletal mobility is a very important part of that. Arthritis per se is a very broad term. Loosely, it means inflammation of the joints. It can be defined, rather subclassified into acute, where there's acute onset pain and inflammation of the joint, which is usually seen in the infection or in the acute onsets of rheumatoid arthritis or the inflammatory arthritis like symptoms. In the chronic forms, it is seen as degenerative arthritis, where the cartilage slowly starts wearing down and you end up with the cartilage deficient joints that is called osteoarthritis. Earlier, we used to think that osteoarthritis is just like part of an aging process, but now we have gone into the genetic basis of the diseases. We have started doing the genetic sequencing, and it has been found that some people are more prone to the arthritic changes, just like graying of hair or the balding problem. And some people have certain mechanical issues and biochemical issues, which also make them prone to the arthritis. So they are the ones, if you look at the age group, even 45 years plus patients, they start presenting with the crippling disease sequelae of the osteoarthritis process. So our main objective is to try to find out the basic cause behind the arthritis, so we can customize our treatment plan as per the patient presentation, his expectations and requirements. There are a lot of products which are available presently at the market. But if you talk about the scientific evidence, you will find that most of them, they fail and they are not able to give you an optimum outcome as required by the patient. So here we are going to discuss only about those certain factors which are definitely going to have positive impact on the control of the disease process and ensuring that you remain pain-free, mobile, and you are able to achieve your objectives in the life. So the first of all, number one, any pain, discomfort. I'm not talking about the sudden onset pains or the injuries or the patients who already have arthritis, rather rheumatoid arthritis, what we call inflammatory arthritis. I'm simply talking about the young active age group where they find that the stairs is becoming painful now. They start feeling some sort of discomfort. If you indulge in some sporting activity, you find that the lunges or after a certain time, your joints, they start playing up. There's certain discomfort. It's not exactly the pain per se. So these are the situations where you need to come and consult with your orthopedic surgeon at the earliest. Because what happens if we investigate with the joints parameters. That includes your blood tests, that includes your X-rays, and also your MRI or MRI cartogram. That means we try to assess the cartilage thickness of the joints and try to understand that is it a generalized thinning down, or there are certain focus where your cartilage is wearing down more. So this happens because of the deformities. And if we can correct those deformities, that is called mechanical realignment, it will be good for your knees, perhaps, in the longer run. We can arrest this degradation process and make them quite healthy. So after the initial assessment, when we have found out the basic cause, we simply put you on lifestyle modification activities. And these basically consist of your avoiding dead weight coming on your knees, such as standing for long hours. Stairs should be minimized to what is really required or needed. Number 3, you are not supposed to sit on the floor or on the low seats. And apart from this, what we have observed that your muscle exercises to strengthen the muscles of your core, of your hip joint, and or of the knees. This is just like providing adequate air pressure in your tires so that your car can travel well. So what happens if the air pressure is not adequate, your car is not running well. So same way, if you are able to make the muscle strengthen, this is just like pumping air into your tire. Your joints suffer less load, less stress, and your body does function very well. Apart from this, in the acute phase, we do prescribe some painkiller drugs, and there have been some talk about the stem cell therapies or the PRP, that is platelet-rich plasma injections into the knees, which are supposed to help in the regeneration of that cartilage. Well, the research is still on. There are a lot of studies at present going on, and we are trying to find out whether it's really helpful. If yes, then what type of stem cells, in what concentration, and what should be the frequency of injecting these drugs into the joint so that you are able to get your cartilage thickness back. But at the moment, they are more like in the experimental phase, and we're still not sure 100%. We cannot predict in which case these particular injections are going to work or not. Perhaps in the young age group, wherever there is fresh injury to the cartilage, these stem cells, they do wonders. But in the old age, with the chronic breakdown of the cartilage, this injections, they don't have that much good role. More injections are talked about the steroid. They definitely have a clear-cut indication in the acute phase. When your knee joint is swollen, it brings down the swelling rapidly. And then you have hyaluronic acid injections, so-called oil injections of the knee joint, which provide adequate lubricating surface over the knees so that you can have more smooth functioning of the knee joints, more smooth movements at the knee joint. But they, again, as I said, we really cannot be sure in which percentage of the patients they're going to be effective. But in the initial stages, grade 3+ osteoarthritis, they do have a definitive role. I would really like to emphasize on this particular fact that joint replacement has come out to be a wonderful surgery, which definitely changes your life for the better. There are only 2 elective surgeries which have a very high success rate. The first one is cataract surgery, where your lens, which has become opaque, we simply replace it with another lens, artificial lens, and it has a success rate of 99%. And the second is joint replacement surgery, that is hip joint replacement and knee joint replacement. And you will be amazed to know that you have 98% success rate. And the patients, they have a wonderful experience. They're able to regain their freedom of independent mobility. They can have an active life, going out, going for the tours, the world tours, everywhere. and it definitely changes your life altogether. But it comes with a rider. When we talk about failure, that means 2% failure means that the joint surgeries has failed and where you had to resort to the revision surgery. And the most common indication remains infection and periprosthetic fractures and the loosening. Then we come to the point, there are certain class of patients which have unhappy knees. And this percentage it varies from 20% to 30%, which is quite huge. And if you go to the literature, you'll find that you have at least 15 causes after the joint replacement surgery. There are 15 causes, and the patients can have unhappy knees. Unhappy knees means whenever a surgeon looks at the X-ray and even examines, you find everything is fine. But the patient is not feeling 100% confident, or they are not 100% happy, comfortable with those knees. And if you look at the literature, you'll find that these are the causes in which you have almost 20 to 25% of the time, it is the patient's own lack of motivation, lack of exercises, which causes the unhappy knees. Hence, if you are able to get your knees operated at the right time, then your muscle strength is still maintained, your balancing power is still maintained, and you have the motivation to undergo good exercise, rehabilitation, and you will come in that 98% successful patients and more than 80% happiness. But if you try to delay your surgery by, let's say, 6 months or 1 year, and if that period you are confined to the bed, sitting on the bed all the time, your muscles starts getting wasted so profoundly, and so much so that you are not able to get the maximum mileage out of the surgery. Because once you get used to it, number one, used to sitting at home, not going out, you get adjusted to that type of sedentary lifestyle. And it becomes very difficult for anyone to shake you out of your chair, your comfort zone. And number two, once your muscles get wasted, getting the same strength back is something which is going to be very, very difficult. You have to work extra hard with more weights, 4 kg, 5 kg, going up to 10 kg to get the desired strength. That's very, very important. Hence, you should go for the surgery moment you feel that your activity level has started going down. Don't wait till it has become zero. And there are a lot of options available in the market. You look at the people advertising the so-called robotic surgeries or the computer-assisted surgeries. Then you have debate about the various types of implants, half knee replacement or the full knee replacement. I would tell you one thing. All these technical advancements are wonderful, no doubt, but they have their own role in the whole spectrum of the treatment. The robotic surgeries, definitely, they give you more precision, but then you may not require that because everybody has their complete spectrum. Like my heart rate is normal, even if it's 60, even if it's 80. So that there's a range. The same way your knee joint has a range. So you cannot fix a fixed value which needs to be attained by that robot to make the surgery successful. And a good experienced surgeon who has 1,000 plus joints surgeries experience, he'll be able to give you a better outcome as compared to the robotic. Then computer navigation. Of course, robotic surgery is just one extension of the computer-aided orthopedic surgery. So what happens here is just like your GPRS. When you have to go from point A to point B, then you need that GPRS. If that route is something, you have been using that particular route for years together, you know each and every pothole, you know each and every bottleneck in the traffic, you know where the people they are rash. And so if you already know all these things, you don't need GPRS. So the actual requirement for the computer navigation is in about 10% of the cases where there are certain deformities or there's a hardware like plates and nails already present around the joint, so that your conventional instrumentation cannot be used. In such cases, the use of computer is absolutely mandatory. Otherwise, you can get away without that also. Then there is a debate between the half knee and the full knee. Well, the idea is in the young age or in the old age. So let's say we are talking about up to 50 to 55 years of age group, and then 70 plus age group. In the younger age group, only there are three joints in the three compartments in the knee joint. And in the younger age group, you are likely to come across with the people who have only one joint involved. So it makes sense to replace only that joint, but that particular compartment. But then it's an ongoing process, that is degenerative osteoarthritis, and other compartments are also going to be involved subsequently. So after 10 years, you may require another surgery to completely change the knee joint replacement. And similar logic goes to the your old age subgroup, where you have 70 years plus patients. Again, since even if the degenerative process goes on, they will have active life even with the half joint replacement also. So these are the patient subgroup which does very well after the half joint replacement only. And yes, they are going to have a very good and meaningful life. So this is in a nutshell about the arthritis, symptoms and management. If there are any questions, I'll be too happy to take them. Abhishek? I think this is a very pertinent question, Abhishek. Knee joint replacement surgery for one knee or both together. Let's say if you have only one tire which is burst and it's bad, only that one needs replacement. But if you have both the tires gone, then it makes sense to replace both of them at the single go, for the simple reason that the hospitalization would be one time. It is more cost effective. Whatever efforts, physiotherapy, rehab, medication, whatever you are taking, it will be for the single episode only. And if you go to the literature, it doesn't matter really after 3 months whether you have undergone single joint replacement or both the joint replacement surgeries. But there is a caveat. The patients 70 years plus age group, those who have multiple comorbidities like hypertension or diabetes or any such issues, where after the pre-anesthesia checkup, the anesthetists feel that the body may not be able to take the stress of both the joint surgeries being done simultaneously. In that case, we can defer it, do one, and do the second one after ideally 6 months. But if we have to push it, we can do it after 3 months also, so that the body gets adequate time to recover itself from the stress of the surgery. I hope it answers your question. Benign joint hypermobility syndrome. So benign hypermobility syndrome is what? When you find that your joints, they are hypermobile. That means if I extend my elbow you can see it is straight, but in the hypermobile, it will go more backward. So that means the ligaments, they are lax. So such joints, they are more prone to develop repetitive injuries and hence early onset of arthritis. But they are not the arthritis per se. It is only the ligament laxity. If the joint remains good, but they are more prone to early arthritis. There's a question from Mr. Arvind. Can the arthritis be cured or this is lifetime? All right. So this is, okay. So if the arthritis is septic arthritis, that is infection, then yes, it can be cured. You do multiple lavage to wash the joint, give appropriate antibiotics, you'll be able to cure it. Number one. If you are talking about inflammatory arthritis, so you have inflammatory arthritis means rheumatoid arthritis. So where, I mean, this is a disease which is characterized by repetitive episodes of acute inflammation and gradually destruction of the cartilage. So moment the problem starts, you have disease-modifying anti-rheumatoid drugs. They should be started at the earliest and maintained throughout the life to prevent the onset of acute episodes, which can cause acute swelling and pain, as well as preserve the integrity of the cartilage. So this is very important. Then if you talk about the degenerative arthritis, this is not something what we talk about the cure. It's just like your diabetes and blood pressure. You just need to stick to a healthy lifestyle. And fortunately, with the healthy lifestyle only, we'll be able to maintain the symptoms. We'll be able to prevent the further worsening of the cartilage, and you will have a symptom-free life. So luckily, you may not have to resort to any medication for the life. Just a healthy lifestyle is going to be more than sufficient. So there's another question from Vidhi. How can arthritis patient take care of themselves during winter? Well, you seem to be having an arthritis patient at home then, because it's a very specific question. All right. The joints definitely, they fare worse during the winter sessions and during the rainy seasons. The exposure to cold does aggravate the joint pain and stiffness. So if you have to go for your evening walks, morning walks, see to it that you do it after the sunrise and before the sunset. So that time when the sun is out, you go for your walks and your exercises in the outdoors, it will be fun. Number two, you should need to keep your body temperature, rather the temperature inside the house, to your own comfort level. And avoid exposure to the cold, especially of the joints. You should be wearing adequate warm clothing, and definitely, yes, it will work. Brachial plexus injury is related to arthritis. This is a question from Praveen Singh. And what precautions we can take after the brachial plexus injury? All right. I hope we understand about the brachial plexus. So you have that bunch of nerves which are starting from your spinal cord of the neck and going into your arm from the shoulder. And so this bunch is called brachial plexus. Brachia means arm, and plexus is the network. And yes, they are important for the movement of your shoulder, elbow, wrist, and the hand muscles. And unfortunately, yes, the injury which you sustain after the brachial plexus injury is something which is very incapacitating. So it's not exactly the pain of the joints. So this is not related with the arthritis. Your nerve injuries, this is basically a nerve injury. There are certain fibers, if they are torn, then it causes intractable pain. All right. So if you can have associated pain, but that is only because of the nerve injury, not because of the arthritis. And the treatment is earliest surgical intervention to repair those nerves, or if they are not repairable, we use the nerve graft to bridge the gap between the two nerves to get the optimum function after the brachial plexus injury. And if the nerve injury is so bad that you're not able to get the function of the whole of the arm, then my priority is the hand. Why hand? Because during the evolution process, the man has given a hand to do various activities. So our priority remains the hand movements and the elbow flexion. So these two activities are very important. So for that, even if we have to sacrifice the movement of the shoulder joint or wrist joint, it is very well accepted. So the only joint surgery which is done in the brachial plexus injury is the shoulder joint arthrodesis or the wrist joint arthrodesis. Isha Sharma, what causes pain in knees when walking up the stairs? All right. So this is very interesting. I mean, you all rather our accommodations, they have become such that we have to use a lot of stairs nowadays. Earlier, it was only horizontal habitation, but now because of the increase in the population, the only space available is going up rather. So that's why we are having more and more stairs. Stairs are bad per se for the knees as such. It may not be good for the overall exercise when you want to lose your calories. So whenever you are going up, so that means there is single joint loading. When we talk about the single joint loading, means all of the body weight is coming onto that particular knee joint. If your body weight is much, or your muscles, because ultimately it is the muscle activity which gives you the enough strength to go up. You put your knee on the above step and then you heave your body. So this is happening because of the muscle contraction. So if your muscles, they are weak or they are poor in strength, that means whole of the load is coming onto your knees. And that's why they start paining. If your inner side knee is paining, that means that particular compartment is having less cartilage. If the outer side compartment is paining, that means it is the outer joint compartment which is having less thing. If you're having anterior, that means in front of the knee joint, that is just behind the patella. So that means this is the patellofemoral joint which is getting stressed. So this is how we are able to find out and understand what exactly is happening. And so apart from the joint arthritis, the other causes of pain can be because of inside tissue called meniscus or the ligaments or the cartilage, which itself gets injured. They can also cause pain whenever you use the stairs because there is single joint loading again. I hope that answers your questions. Any other question in that particular field, I'll be happy to answer them. Now we come to Mr. Ram Kishore, who says, knock knees come under arthritis, can be cured in adults as well. Will it be a problem if left uncured or untreated? Fine. So the knock knees, as I discussed earlier, it is about the deformity of the knee joint. The mechanical axis is deranged. So it's definitely putting more stress on one particular compartment. So whenever in such a situation, when there's excessive loading of one compartment of the knee joint, the cartilage of that particular compartment wears down fast. So yes, it's an issue, it's a concern, and it should be corrected at the earliest in the life, whenever it presents itself. And once you're able to correct the alignment, the loading of the joint becomes uniform, and it helps the prevention of arthritis. But let's say you continue with the knock knee problem, then your outer compartment gets overloaded and they get arthritic. And when you require surgery, yes, they can be replaced in isolation or in total as a part of total knee joint replacement surgery. Mom is suffering from the arthritis from past 8 years. And we have consulted specialist doctors, ortho neuro. However, there is no genuine outcome we have got. All right. So I presume that when you talk about arthritis, that means it is the knee joint which is painful. And if you have consulted neuro, ortho, physician, everyone, so that means there is some confusion about the diagnosis. So that means the X-rays might be fine. You may not find that much decrease in the joint space. Neurologists must have examined the spine and must have ruled out any spinal cause. So that remains, there is some soft tissue element inside the knee joint, which could be the cause of concern, or there could be referred pain coming from the hips. So you basically need good quality X-ray of the hip joints to rule out referred pain from the hip joint, and you need good MRI scan of the knees to find out the cause outside within the knee joint, apart from degeneration of the cartilage. All right, Shahid. So apparently there is a significant loss of function in your mother's case. Apart from activities of daily living, she is not able to do anything else. So this is definitely not a good situation. So I recommend that you share her papers, X-rays with me. I can share my email ID with you. Can I? So you can send the reports here, and we will get back to you with our opinion, whether it is correctable, treatable, or whatever. But in my opinion, everything has a solution. We just need to find the right connection. Healthcare.com. I can give you my mobile number also. Dhananjay is with the small d. Okay. 981028977. So if you can just write Shahid and send me your, either mail me and send me WhatsApp, I'll be able to answer you back. No issues. Mr. Deepak Sandal. So, appendix means inflammation of appendix. I mean, appendicitis. All right. Cholecystitis is inflammation of gallbladder. So arthritis means inflammation of the joints. It's a different matter that we have multiple joints, right, from neck, shoulder, hip, knee, up to the foot. So any of the joint can be painful. And we just need to be very specific what area we are looking at. Okay, so I understand. So this is a part of the question where you feel that is there any association between various symptoms and the arthritis? Yes. Sorry, it took me a while to understand your question. So there is something called, which is again a genetic problem called genetic osteoarthritis. So here at the young age, almost all the joints, including your shoulder joint, your spine joints, your hand joints, your knee joints, they are affected. It's a very disabling condition, and yes, it may make the patient handicapped at quite an early age. Then there are so many syndromes, especially with the inflammatory arthritis, that is rheumatoid arthritis, where you have arthritis, that is inflammation of the joints, along with systemic features also. Like in ankylosing spondylitis, you have the arthritis of the whole of the spine. This calcification becomes a bamboo-like. There's involvement of the sacroiliac joints and the hip joints. They all become fused. And because of this extreme curvature, your gastric capacity starts decreasing, your respiratory capacity starts decreasing, and you are hunched up, your visibility, everything gets affected. So yes, there are a lot of such syndromes where apart from the simple arthritis, you have other systemic features as well. Okay, so she has been having, I think it must be some form of inflammatory arthritis, and it must be quite fulminant or in the bad form. That's why she had to resort to the steroids. Yes, so the ideal treatment by these patients is done by the rheumatologist, and it's basically you will need to maintain a balance between the steroid medication and other rheumatoid arthritis medication, which can maintain the function. So luckily nowadays we have so-called biologicals, so which directly act against those agents, those factors which are causing repeated inflammations and destruction of the tissue in the body. But they are very highly priced, and they have their side effects. And the best person to recommend them, advise them, is a rheumatologist. We have a very good rheumatologist here in our center, Dr. Professor Ashok Kumar, and he can be consulted on every day. I think you definitely should consult a good rheumatologist to take it further. Right leg knee pains a lot while driving cars, sometimes while walking. Ayurvedic treatment still of no use, trying Ayurveda. What's your age group? I couldn't get that. Because if it's happening only while driving the car, and so the right side means your accelerator and brake, accelerator and brake. Well, what we have realized that the people who are driving the car with the conventional gears, it's the left knee which starts getting more painful because of the repeated pressing the clutch, and you have to really press it hard, So that is something which is a cause of concern. The right side, there might be some pathology, and I think if the X-rays have not shown up anything, you should get an MRI scan done of the right knee and consult a good orthopedic surgeon locally in that area. External fabric-based supports. All right, so we are talking about the knee joint arthritis, where you feel that there's a deformity at the knee joint and one particular compartment is getting loaded. If you use the brace to unload that particular compartment, you'll feel definitely much better. Well, yes, theoretically it is possible, but for that, your deformity should be mobile. I mean, it should not be fixed, that particular deformity. If you do the stress, you will be able to correct the deformity. Only in such cases, those braces are going to be useful. Number one. Number two, it should always be accompanied by various exercises, lifestyle changes. Otherwise, the disease will keep on progressing, and after a certain time, your deformity becomes fixed, and these braces will stop working. Number three, the biggest issue is compliance. We have seen so many camps being organized, and these braces are distributed left, right, and center. People, they take them home, and after a couple of weeks, you find them, they find it rather inconvenient, because at night they have to get up, let's say 5 times to go to the washroom, and every time you put it on, it becomes difficult. And in the daytime also, the compliance is definitely an issue with these braces. All of a sudden, the questions have started coming. Oh, Vidhi, yes. Women are more prone to joint pain due to loss of calcium in the bone. Any suggestion on that? That's a very interesting question, very apt question also. Women, they are, due to the hormones, various cycles of the hormone childbearing, there's so many changes happening inside the body. And hats off to them that they're able to pull it off nicely. But the fact remains that once that vicious cycle sets in, where you start increasing, putting on body weight, it becomes very difficult, because ultimately all that load is going to come on your knees, number one. Number two, you never give preference to yourself. For you, the family comes first. So you start neglecting your diet, your health routine, your exercise routine. So that's the reason you find more aches and pains in the females, not because of anything else. So this is something you should take it to your heart. You come first. Like in the flight also, they say, whenever there is oxygen deficiency in the cabin, the mask will come down. You put on your mask first. Put the mask on the kid second. Same way, you should devote enough time for yourself so that you have a healthy body and without pains. Calcium deficiency and vitamin D deficiency, yes, but they are not the only cause behind the joint pains. A healthy lifestyle is much more important, and a balanced diet, of course. You said the next question is causes pain in knees when walking upstairs. So if this happens because of patella, then what prevention can be considered to cure the same? All right. So as I said, there are 3 compartments in the knee. When you are going upstairs, it's the side compartments, inner and outer, which are more loaded. When you are going downstairs, then it's the patellar compartment, which is under tremendous stress. All right. And also, if you are jumping, jogging, skipping, aerobics, or if you are sitting with your knee bent for the long time, so all these situations, they are putting more stress on your patellofemoral compartment. And I'll come to this question. So coming to patellofemoral, so you need to avoid low seats. You need to avoid keeping your knee bent all the time. Avoid the stairs, avoid high impact activities. Build up the quadriceps muscle as much as you can. That helps. Once you're able to do that, you will find that your patellofemoral symptoms, they are definitely come down to the manageable levels. So Mr. Arvind Kumar is asking, who is the best department to treat paresthesia? Or is the physiotherapist useful for paresthesia? So paresthesia means abnormal sensations on the limb or any part of the body as such. And definitely a neurologist is the best person to connect, to diagnose. If it's in the peripheries, yes, we orthopedic surgeons can also diagnose and start with the appropriate treatment. Physiotherapy, we have too much of expectations from the physiotherapists. We feel that, I mean, they can, it's just like Ayurveda or homeopathy or something. It's not I would say, it's not a pathy, it's not a treatment form. All right. So what physiotherapy does is try to stimulate your muscles or the joints or the nerves to get the required function. That's it. So they are more of a paramedical branch rather than the medical branch. I hope, unless and until a doctor, that is neuro or ortho, has seen the patient, made a diagnosis, only then he can recommend what type of physiotherapy is going to be ideal for that patient. If you go to the physiotherapist first, you are likely to miss out on certain important aspect of the diagnosis, which may aggravate your problem further and cause the treatment much more difficult later on. Yeah, I'm quite happy with the quality of questions which have come up. Simply shows that, yes, you people were listening to me and you were prepared. So, yes, we don't have any further queries. So with this note, I'll like to take your leave. Thank you so much for joining us and making this event meaningful with your questions. I really appreciate that. Thank you so much. You have my number, you have my email ID. You're most welcome to connect with us anytime you want. Thank you and goodbye. Thank you. It's been a pleasure.